When you think about modern healthcare, your mind probably jumps to MRI machines, breakthrough drugs, all that high-tech stuff. But what if I told you the most critical asset in the entire system isn't a machine at all? It's the people. The nurses, the doctors, the techs, everyone providing the care. Today we're going to try and piece together the incredibly complex puzzle of how we manage them.
I'm sure you've felt this, right? You're stuck in a waiting room, or you see a news report about nursing shortages and you just wonder what's going on. Well, that feeling, it's not random. It's a symptom of a massive challenge right at the heart of our healthcare system.
Okay, so let's really dive in. A healthcare system is only as good as the people working in it. And managing all of those people is kind of like solving this giant, intricate puzzle where every single piece matters. So we're going to start by zooming in, looking at the puzzle pieces inside just one hospital. And then we'll pull the camera back to see the whole picture.
First up, let's zoom in. We're going inside the hospital walls to see how the game has totally changed when it comes to managing the people who make it all run.
Think back. It wasn't that long ago that hospitals had a personnel department, and they were basically reactive. Their job was paperwork, administrative tasks, filling slots as they opened up. But today, the best organizations have flipped that entirely. Human resources is now a strategic partner. They're proactive, they're thinking ahead, and they are laser-focused on people because they know people are the key to achieving the hospital's mission.
So, if HR is a strategic partner, what does that actually look like? Well, it means they need a playbook, a really deliberate, forward-thinking plan for managing their most important asset.
And that playbook has a name, Strategic Human Resources Management, or SHRM. Now, the magic words in that definition are contributes to strategic goals. This is a huge, huge shift. It means HR isn't just a side department anymore. It's at the table, making sure every single decision about people, who to hire, how to train them, how to keep them, directly helps the hospital win at what it does best, taking care of patients.
Here's a simple way to picture it. Think about a pro sports team. The coach and the general manager don't just pick players at random, right? No way. Every draft pick, every training drill, it's all part of a larger strategy to win a championship. Well, SHRM is the hospital's playbook for winning at patient care. So what's actually in this playbook? What's the secret sauce? Well, researchers like Jeffrey Pfeffer have studied top-performing companies for years, and they found a set of 7 practices that show up again and again.
And this quote just nails why this stuff is so important. Look, anyone can copy your new building or buy the same technology, but Pfeffer points out that it is so much harder to copy a culture, to duplicate a workforce that is skilled, motivated, and loyal. That kind of advantage is built to last.
Okay, so the practices start with building a rock-solid foundation. First, you provide employment security. This doesn't mean a job for life, but it means you're committed to your people and don't see them as disposable. That builds incredible trust. Then, you hire differently. You look for people who fit the culture, who have the right attitude, not just the right degree. And finally, you empower them with self-managed teams, which cuts down on bureaucracy and gives them real ownership.
All right, next up, you have to invest, and I mean really invest in your people. This means, yes, offering great compensation, but also tying it to how well the whole organization is doing so everybody wins together. And it's more than money. It's pouring resources into extensive training. The best organizations see training not as a cost, but as an act of faith in their people's future. And finally, you wrap it all in a culture of real teamwork. This means breaking down those old walls between management and staff. Getting rid of reserved parking spots, things like that, to create a feeling that we are all in this together. And a huge part of that is being transparent, sharing financial and performance data openly, because you can't really ask people to be your partners if you keep them in the dark. Okay, so just imagine this. A hospital has done everything we just talked about. I mean, they have the perfect playbook. They're ready to build the absolute best team on the planet. But what happens when they go out to recruit and there's nobody there? What if the talent pool has just run dry?
And that one question, that's what forces us to pull the camera way, way back. We have to stop looking at the strategy of just one hospital and start looking at the massive challenge facing the entire country.
This is where something called workforce planning comes into play. And just notice the change in scale here. We're not talking about one hospital's goals anymore. We are talking about making sure the entire country has the right people with the right skills in the right places at the right time. It's a logistical challenge on a staggering scale.
So let's go back to our analogy.
If SHRM is the individual team's playbook, then workforce planning is like the air traffic control for the entire league. Its job isn't to make sure one team wins. Its job is to manage all the planes in the sky to make sure the whole system runs safely and smoothly for everyone. So how on earth do you even begin to plan for something that massive? Well, workforce planners have a few key methods they use to try and predict what the country's healthcare needs will look like, sometimes decades in advance. This basically breaks down the main approaches. You can use a simple population-based model, a standard ratio like we need one doctor for every X number of people. You could try benchmarking, where you look at the most efficient health systems in the world and try to match their staffing levels. A more sophisticated way is needs-based. You actually look at the health of the population. As people get older, you plan for more geriatric care. And then there's a demand-based approach, which is more about economics and what services people are willing to pay for.
And to make that population idea really concrete, here's a number for you. In the US, if an area has a ratio worse than one primary care doctor for every 3,500 people, it can be officially called a health professional shortage area. And that designation is a big deal. It unlocks federal resources and support.
So, when you put it all together, here's the crucial point we've been building towards. We've really been looking at two different sides of the very same coin.
On one side, you've got strategic HR. That's the playbook. It's focused on making one team, one organization as successful as it can be. But on the other side, you have workforce planning. That's managing the whole league. Its job is to make sure there are enough skilled players for all the teams, and its focus is on the health of the entire society.
And that brings us right back to our puzzle. You just can't solve it with only one of those pieces. You can't have a healthy, high-functioning healthcare system without both. You need brilliant playbooks inside every single hospital, but you also need a smart master plan for the whole league so those teams can find the players they need to win.
Getting this people puzzle right is without a doubt one of the most important things we face. It takes great strategy inside our organizations and great planning for the nation as a whole. So the question I want to leave you with is this. What do you think is the next missing piece of the puzzle that we as a society need to solve?